Good evening, doctors. To start the session, I would like Dr. Partha Basu to please take over the session. Over to you, doctor.
Okay, thank you all.
Thank you very much. Thank you. Thank you. So it's my proud privilege to start this session with pranam to all of you, all our presidents, past presidents, and our future presidents. So it's a moment of great honor, I think, that we are all here with the presidential conclave. And I would request Maipal sir to conduct this along with Barun sir and Dr. Lalit Verma and Dr. Natarajan sir. So we have in the governing council members as well, and I would invite Dr. Namrata Sharma, Dr. Rajesh Sinha, Dr. Chitra Ramamurthy, Dr. Santosh Honavar, Dr. Arup Chakravarti, Dr. Chaitra, and Dr. Ajay Arora.
KPS Malik, how are you? Sir, you're muted. I can see two Buddhas there. Sir, I can see two Buddhas.
Malik ji. Good evening.
You come back
Good
to
evening.
India,
Good
sir.
evening.
Malik, you come back to India?
I'm in India now.
Okay. Ashok Grover is there. And
Welcome.
Dr. I can see Dr. What is the name? Dr. Tony Fernandez, sir. How are you?
Khosla sir is also there.
Yeah.
Dr. Shukla is
Dr.
also
Kalevar is
there.
on the line, I think. Dr. Kalevar?
Yes.
sir.
Kalevar,
Madam,
madam is
how are
there.
you,
How are you,
madam?
madam? Good to see you.
How are you? How are
Good.
you?
See you.
Madam, I'm missing dancing with you.
I miss Raju's songs also.
What about me? You don't miss me?
I do. I miss
And,
everybody.
and here Dr. Tony Fernandez and my father were colleagues. So Dr. Tony Fernandez has seen me like my 5-year-old. And I've gone to his house in a beautiful back. I remember that still.
I even
Great to see you,
remember
Tony
the
sir.
South
Oh,
Zone
how are you,
Conference
madam?
in
How are
Kochi.
you?
Very well. Very well. Nice to see you.
Welcome, Tony sir. Welcome, Ashok sir.
Thank you. How are you, Partho?
Thank you.
Thank you.
Me
So,
too.
shall we
Devashish has
start?
come. Devashish. And
Devashish,
Partha, I'm
welcome.
totally confused. What is this session?
Yeah, sir. You are confusing the
Learn.
second, sir. Let me introduce, and that's my only part, and then you take over.
I have my part to.
Yeah, good evening, everybody. I think welcome to this particular session. I think pleasure to see all of the past presidents and as Partha said, possibly future presidents also. So Partha, you can start. You have clashed it with the ARC thinking under the
Yeah,
apple tree.
there also we are judges and my Chitra
Yeah.
is not leaving. I told yesterday, how can I come? Sir, okay, Partha, I think
Yes,
one
sir.
homework because we are going online. People
Yes,
like
sir.
me, Maipal, and like few of us here who are very important in 2 sessions should not be clashing with the software.
Yes.
Which I'm trying. I tried doing. I couldn't do in my own scientific
Sir,
chairman.
I know. Yeah.
No,
So,
whether it's ARC,
Partha is,
LDP, right?
So can I quickly share my slide set, and then you can take over. The presidents can take over and conduct the session. So
yeah,
the
Partha, I will actually need to go and come in between. So you can start, and I think if Dr. Dr. Nayak is not there, then maybe Dr. Grover or Dr. Tony Fernandez or Devashish, they can just take over. Okay.
Well,
Join back in
We
between.
should
Yeah.
call the new president
please leave me
also.
alone.
yeah.
That's what I think
Too
was
old.
there.
I think Dr. Nayak sir has not joined the session.
Hi, Namrata.
I don't think he'll join also, huh? I don't know. Maybe he
Namrata.
does.
Namrata,
Yeah.
I have given a suggestion. I think since we are going online, we should
Santosh,
have a
sir.
software
Yes, sir.
where whichever place where like your name or my name is there, we cannot have a parallel session. It's troublesome here.
You are there, no, sir?
No, I agree with you completely.
No, so that we can concentrate. See, I think this presidential conclave is important for AIOS.
Okay.
Chairman,
No, not me, sir.
So continue to,
Okay.
Nati, continue to concentrate on this session.
Can I
Partha, you
can
can
I ask
start.
the admin? Yeah, one moment, please. Can I ask the admin to unmute Dr. Santan Gopal? Santan Gopal sir is there.
No, he better muted here.
So then Partha will ask to mute you also.
No, but I know the software. I can mute everybody except me.
Dr. Conclave ma'am is also there. Nice to see you, ma'am.
Yes,
Yeah,
yes,
Amrita,
yes.
I told Kalaivar madam that I am missing dancing with her.
So the future depends on what you do today, and whatever we do today is dependent on what you have done in the past and how you have led us, how you have brought us up, how you have groomed us. Pay homage and tribute to our past presidents. I have great honor to invite Dr. Tony Fernandez, sir, Dr. V. Kalivar, madam, Dr. Prem Kumar Khosla, sir, Dr. K.K. Mehta, sir, Dr. Ranbir Mukherjee, sir, Dr. Ain Pandya is not able to join, Dr. B. Shukla, sir, Dr. R.B. Jain, sir, Dr. Tara Prasad Das, sir, Dr. KPS Malik, sir, Dr. Rajvardhan Azad, sir, Dr. Ashok Grover, sir, Dr. NSD Raju, sir, Dr. Anita Panda, madam, Dr. Quresh Maskati, sir, Dr. Devashish Bhattacharya, sir, Dr. Ramamurthy, sir, Dr. Santan Gopal, sir, Dr. Ajit Babu Maji, and Dr. S. Natarajan, sir.
So the last two you didn't say sir, Partha. All of them you called sirs. And the last
But
two
I
you
wanted him not to say sir actually.
Thank you very much.
Giving attendance, sir. But Partha,
Yeah,
giving
attendance.
attendance. I want to say yes, sir.
I'm there, sir. Okay, can we unshare? I
Me
think.
Hajaru.
So with these few words, why we structured this session is we wanted to know from you our past, that AIOS has gone from strength to strength, what you have done in the yesteryears, the benefits, the fruits we are reaping, but what we need to do today and how we need to take AIOS forward is what we want from you. Your advice is what we want today. So with these few words, I'd like to ask Maipal sir to start the session and carry on the discussion.
Thank you very much, Dr. Partha, and thank you very much all the revered past presidents who have joined this particular session. I think one thing is very clear, that AIOS is today a fantastic, vibrant society built on very strong foundations that were laid by the past presidents, secretaries, the organizing, the governing council members, etc. We are going from strength to strength, and today we have more than 23,500 members. And there is always striving for improving the academic, scientific content of the meetings, as also the journal, the proceedings, etc., and also to solve the problems of common members and to have political advocacy for improvement of ophthalmologists. I think there are certain areas that we need to do. We have established ourselves as a scientific society, as an academic society, but we need to actually also look at solving problems of a common ophthalmologist, of the youngsters, providing them the forum for excelling in research, I would say innovations, make in India, and also guiding them as regards their future life that is there. So I think with these words, I will just wish to say that let us see. Also, I think there is the important thing of the constitutional amendments that needs to be taken up, and that is something to make the society much more vibrant. I think with these words, I would say that thank you everyone for guiding all of us, and we can have this open discussion as to what are the ways by which we can make AIOS, I would say, the best and the leading society in the global arena of ophthalmologists with our case.
I think Dr. Kalaivar is the senior most, I think, here in the group now. So maybe Dr. Kalaivar can start her what when she was the president, whatever she thought, and what is it today in 2021, and what is she looking for in 2030. Dr. Kalaivar, madam.
First and foremost, I pay my respects to all the past presidents, right from those whom I knew from LP Agrawal, SRK, HK, and RP Thanda, Shiva Reddy, Nihar K. Munshi. My first contact with these people was in 1968 at the Ahmedabad conference, 67 or 68, Ahmedabad conference, when we were all only young members. The only thing I can say about the future, we were only a few hundred members, and now we are thousands of members. The question is, do we do enough for the younger people? We have to. We have to guide them. The most important thing today is what they feel, what their thoughts are, we have to make them good human beings, not only good doctors, good ophthalmologists, but very good human beings. Since this corona, I have been saying to a lot of people that the God is angry with the world. He created such beautiful world, such beautiful human beings, and the human beings have destroyed it. We want to make, we want to cut the forests and make the cement forest, cement jungles. And that's exactly what we have to do. And the most important thing is what I think is friendship, dosti. What is the friendship? Hello?
Yes, madam. We can hear you.
Yes, ma'am. Continue,
We can hear
ma'am.
you, madam.
We can hear you very well.
What I said back many years back in Calcutta, Parth, I want to repeat here. What is friendship? Friendship is not only the word that you can wipe away. It's not only a journey that comes to an end. It's the whole lifetime. And that's what we have to instill in our younger ones, their friendship with human beings, their friendship with the society, their friendship with the members must be long lasting. They must be sincere, honest to their teachers, to their younger colleagues, to their own, what shall I say, own friends. And
Yes, madam.
Yes.
No, yes, I think we agree with you. I think you are talking about the human touch, which is required with all this.
And the question is, well, who do you respect? From the primary school teachers to your medical college teachers. That's what we respect, the teachers, and we have to respect the feelings and thoughts of your colleagues. You don't have to be very good. The question is, people who do things properly, sincerely and honestly are the good people. You don't have to be always a scholar, 100%, 90% student. You have to be a good person. That's far more important in today's world.
Yes, madam.
I remember Dr. Subramaniam, when I was there for the South Zone conference back in 98, 97 something, and I heard NSD Raju singing, but I didn't know it was NSD. It was Dr. Subramaniam, and we were sitting in the garden, and I heard Mukesh singing. So I asked Dr. Subramaniam, who has put this CD or what record on Dr. Mukesh? Said, no, it's not Mukesh, it's NSD Raju. And that's when I learned that NSD Raju sings like Mukesh.
Madam, you'll be happy to know this time, all the 4 days, there is entertainment, singing, dancing by the members, for the members and of the members, thanks to Partha and Namrata for doing that. So every day from I think 7:30 to 9:30, every day it's going on, and I also took part. So, madam, with this, I will ask Dr. Tony Fernandez, I think is the next senior here, who actually knows me from when I was 5 years old. And when you told about 1968, I remember attending as a school student with my father the 1969 All India Conference when Dr. B.T. Muscati and Dr. Hila Vakil, I still remember, and Dr. Rahim Muljiani were there. The dinner was in Taj Palace. and I stayed in that MLA hostel, and we also had one hotel. Nataraj was there in Marine Drive. Anyhow, Dr. Tony Fernandez, sir, your views.
Well, I only want to pay my respects to everybody. And one thing I want to remember is the three great ladies who started ophthalmology for women: Hamida in Aligarh, Sudha Avasti in Sitapur, and Sudha Sutaria in Bombay. These are the three ladies whom I respect.
Sudha
And
Sutaria from Nagpur.
pardon?
Sudha Sutaria from Nagpur, madam.
Yeah, Nagpur
Bombay,
afterwards.
Nati, Bombay. We lay claims to her
Yeah.
because she was knee Modi. She was knee Modi before she became Sutaria in Nagpur.
She
That's
worked in
why-
Sitapur.
that's-
She worked in Sitapur a lot of years.
Correct,
That's why I
agreed.
said Sudha
Yes.
Sutaria from Bombay. Nagpur
You're
Okay.
right, madam.
related-
Absolutely right.
All four statements are
I
correct.
tell you,
He fell in love with somebody in Sitapur only and married him.
Yeah, but
army person, no?
Go on, madam. Natarajan, you can keep off little while. Yes. Your teeth are so shining.
The it's not working. I can't see.
Shall we have?
I'm Satan.
Shall we have Tony sir? Tony sir is there. Tony sir, a few
Admin,
words from
can
you,
you,
sir.
yes, from somewhere some noise is coming. Admin, can you mute?
I think Dr. Anita Panda.
Ma'am. Yeah.
Tony, sir, you can talk.
Tony sir.
Yes,
You can talk, sir.
Good afternoon, sir.
good afternoon.
Can we mute everybody and then people who want to speak can unmute themselves?
Yes, sir. Dr. Tony, sir, you can.
Okay, I remember the years. I joined the All India Ophthalmological Society in 1969 at Bombay. Dr. Muscati, as you mentioned, was the secretary, and we had a wonderful group and very nice, close friendship between all. Now the association has grown very much. I think it is 15,000. And the scientific explosion taken place in the last so many decades has made the more and more people coming for the conference and sharing their scientific knowledge. I'm very happy that All India Ophthalmological Society has grown up so in such a beautiful way. And I appreciate, though I don't actively participate, I watch, and I am happy to say that you all have done an excellent work. I have nothing but appreciation for that. What more can you do? You have been doing it very well. The only thing I would like to suggest is that, you see, though we have scientific knowledge exchange and other things, we don't have a newsletter, a regular newsletter to say that who are some of the, see, the personal details of some people are not available. Say for the last 1 or 2 years, some senior person who was the president of the All India Ophthalmological Society, he dies. Perhaps in the north you might know, or the south we might know about him. But you must have a unofficial, non-scientific newsletter once in at least 3 months by the All India Ophthalmology Society.
I think
Giving the news of the people who have died, who was the vice president, so that all over India, these messages are available. Many times I get a shock after 2 years and all, that such a person who was working with me and was colleague in me for a few years, was a president of the All India Ophthalmological Society, died about a year ago. You know what I mean? There must be a personal connection between the members. And I think a non-official, that is do not take everything scientifically. When we started the journal had scientific part as well as some personal part. Say in journal, they used to announce people who have died, and outstanding ophthalmic surgeon who was a past president of the ophthalmological surgeon died such and such a day. Even international well-known people, the death versus. This is the only suggestion I have. I wish you all the best, and I again congratulate you, all of you, for bringing up this association to such heights. I'm sure you will be as good as any international association or American association within a few years. Thank you very much.
Thank you.
Yes, sir.
Thank
you
you
very
so
much.
much. Thank you so much, sir. I think we do have it, but not at the frequency that we should have. And I think we will increase the frequency of the AIOS newsletter. And I think we will incorporate this, sir. Thank you so much, sir.
Thank you.
Shall we?
And possibly add the
Sorry, sir. Dr. Grover.
component a little more to that newsletter. Possibly add a little more to the social content of the newsletter,
Yes.
as Dr. Fernandez was.
Yes, yes.
Yes. Dr. Khosla sir is here. Dr. Khosla sir.
I don't think sir has joined. I don't see.
Because Amit had promised that Khosla sir would join. But anyway, if he joins a little later, that's fine. Dr. K.K. Mehta sir.
I don't think he's also joined.
Somebody call Barun also, give him a call to say if he's joined.
Yes, yes.
Because he's the one to give direction to the society now.
Yes, absolutely. Dr. Ranbir Mukherjee, I had contacted. Sir is not very well. So he said that I wish to convey all my blessings to the future generations, and I wish to greet the people whom I have known and in my time. So I would like to convey to you that Dr. Ranbir Mukherjee is very, very much aware of all the happenings, and time to time he advises, he calls up and he says that this is what you should do, this is how you should do, and we are really grateful to him for that. We have Dr. B. Shukla sir. Dr. B. Shukla sir is there. Dr. Professor
Yeah,
Shukla,
sir is there. I saw that sir is logged in.
Can you unmute Professor Shukla?
Arthur, you have everybody's birth dates on record that you're going strictly chronologically.
Strictly according to seniority.
I suggested that he put a president list. Year-wise, I told him to go through.
Yeah.
Not the birthday. When they were a
Seniority.
Seniority of the president, yes.
Yeah.
It was my
So,
wedding
Shukla sir, I think,
yesterday.
Oh, many happy returns of the day, Dr. Jain.
48 years.
No,
completed.
I did see Dr. Shukla sir had logged in.
Yes,
but
yes.
now
He's
I
unmuted. No, he's unmuted. Yes, yes. Shukla sir? Shukla sir?
Dr. Barton to Shukla sir.
Okay. Shall we go to Dr. R.B. Jain sir? Okay, Shukla sir is there.
He's there. He's unmuted also, but I think
Can somebody call him on the phone? Because I think he generally has difficulty.
I'll call him.
Yeah.
No, somebody has to tell him how to go on the screen and how to put the
No,
video.
he does it, sir. KPS, sir. He does it. Only thing is, I think every time.
When he's with me, then he does everything good.
R.B. Jain sir is here, sir. R.B. Jain sir?
Yeah, I am here.
Yes, sir.
yes, sir.
Sir, your words.
Well, I think, how do I, can you see me?
Yes, sir.
Very well,
Yes.
very well.
Right,
Sir.
Very
well.
well. So when you view on the gallery, you can see everybody.
Yes, gallery, I can see. Yeah, I'm not coming in the speaker's view. That's why.
No, the moment you start speaking, sir, it will come.
Okay, I'm speaking now.
Yeah,
so, anyhow, so I think AIOS is working very well. I have nothing much to add. Namrata and Maipal have done very good work in the last 2 years almost. Only thing, these days the constitution amendment thing is going on, and I am not very happy with the way things are moving, because it appears the recommendations are to sort of please a particular section of the societies. So that is what I would like to say, that one should think of the society as a whole rather than a few individuals who might be benefited by change in constitution. Constitution is a very important thing. I've been involved in the days of Dr. Daljeet Singh. He used to ask me to send recommendations. I used to send them. I've written constitution of DOS for almost 15 years. So I think constitution should not be changed at the whims of a few people. That's what I would like to say. It is some points are definitely there which need to be changed. 100% I agree. But changes should be done depending upon the requirements of everybody. I think the society is running very well, and I wish all the best.
Thank you. Thank you so much, sir. We would look into the constitutional review also, which is, I think, which it should happen because we were nearly there. So I'm sure we will make it this year. Dr. Maipal, sir, would you want to say something on the constitution part?
Well, all that I will say is that this particular thing, there are certain issues which normally are part bylaws have gone into the rules and for whatever reason. And I think there is some sense of alienation among certain members. So I think we need to broad base the society a little bit more. And we need to also have the opinion. I think what Dr. Tony Fernandez was also saying, non-academic meetings also of these brainstorming sessions that is there. So I think the constitution should be there to help improve the functioning of the society and for participative increase in the participation by all the members. So there is a lot of things that have been going on from the time of, I think, Dr. Babu Rajendran tried it and things are still not done. So I personally feel that all the people should come forward and give their recommendations on what amendments should be there and what are going to make the society much better. And I think there should be, there is a lot of time and effort that the office bearers spend, because I know, for example, even Dr. Namrata, her time that she has spent, had it not been with her kind of skills, turnaround time and perseverance, I would say that a lot of things would not have happened during this difficult time that we have gone through in COVID. And there is a lot of work, advocacy, etc., that needs to be done. I think the society has come of age where we need to have individuals like, if you look at the American Academy of Ophthalmology, they have about 150, 200 staff. I don't know the number, Namrata might be able to tell, but there needs to be more professional help. I know the back office people are doing well, but we need to have people to take care of certain aspects of the society, which we as professionals may not be able to spend our time. That is something very, very important. And the society is today getting great international recognition, as also nationally it is recognized as a force to be, whether it be within ophthalmologist or within the other medical professions. So only thing is that we have to have our listening increased and improved among the officials, the government, and be associated with policy decisions that impact our members that should be taken by the government. Constitutional amendments, just on that particular point, I think we can push for maximum number of people suggesting what are the user-friendly or member-friendly constitutional amendment, and they should be implemented and take away the issues that have been being raised from time, I would say, immemorial, 15, 20 years. That's what my thoughts are about it.
Thank you, sir. Can we have Dr. Shukla has joined? So Dr. Shukla? Dr. Tara Prasad Das, sir?
Yes, I'm here. Thanks, Partha, for organizing this. While AI is doing very, very well, I will say, than what it used to be once upon a time. I first went to my AI was in 1981 in Calcutta, and since then I'm being kind of regularly going there. I want two additional things for the AIOS current leadership to consider. One, like American Academy of Ophthalmology has done something called big data analysis called IRIS, Intelligent Research Insight. Can we have the huge membership and a huge country and huge number of procedures to do? Can you collect all the data and analyze it for our own benefit to make amendment protocols, standard of procedures, etc., etc.? Those of you who do not know, I'm sure everybody knows this. We roughly do 7 million cataract a year, which is 25% of the world. Look at the data. Do we have the data of the people who benefited, not benefited, or economic considerations? We do not have the data. The data collected by NPCV, Government of India, is only those whom they give the money, reimburse the money. That data is mostly available, but not everything is available. So once you consider the big data thing, it will very well. Tomorrow it will be the real world data, will be the real world thing, no more epidemiological studies. And two, despite being with 25,000 people, enormous activity, and we are doing very well in eye care in the world actually, we still do not have a big role. AIOS doesn't have a big role to play in the national eye health policy making. We are being sidetracked. Some organization, let's say, not to identify, let's say AIMS being closed in Delhi, they are already participate. Number of them are participating as a AIMS professor, not the AIOS secretary. So somehow the AIOS being sidetracked. I tried, when I was president, I met the then health minister a couple of times and tried to persuade many things. Nothing happened, but then that maybe I was a little behind time or far ahead of time, but that should be important both in the state and national level. Can you participate AIOS big way in the state and national eye health policy making? Apart from these two, which is very important for the future survival and growth, let's say AAO, how it's improving, IRIS. It doesn't matter what software you have got for your EMR, electronic medical record system. They collect everything and collect the policy, and it influences the insurance companies and outcome analysis, etc., etc. They come out the ophthalmology every time. So we are still struggling to collect our data. And finally, even though we do not have much role to play in residency program standardization, because we are not MCI and we are not work with them. And come what we say, in a huge country of 300 plus medical colleges, standard cannot be the same, even though theoretically are all same, but practically it is not same, must acknowledge it also. Since we cannot influence those curricula or the training program, can we have some kind of a decentralized, every state or every zone, a skill enhancement center where people can come in and go? Now, these ones are already happening, I know, but then this is not part of the curriculum. Suppose you say that X university or Y state medical school, the student must have as a part of thesis, must complete X number of hours of doing this kind of a simulated skill enhancement or something like that, and that will be impactful. Now, how many of us will like to sit in an aeroplane when the pilot announces, welcome board, this is my first flight, and you will not like it? Similarly, patient will not like somebody say, I am the first surgeon. That reminds me about a joke which I heard from senior musketeer. And Kuresh, allow me to speak this, and please hear, I know you are muted, but please hear. And this partly in Urdu, Hindi, partly in English, I will speak. बॉम्बे में हॉस्पिटल में जहाँ पर सीनियर मस्करी काम करते थे, वहाँ पर वो थिएटर के सामने आगे पीछे हो रहे हैं, बंदा बैठा लेटा हुआ है स्ट्रेचर में, पूछ रहा है सर क्या टाइम हुआ? 9 बजा है। 3 मिनट के बाद क्या टाइम हुआ? 9:03। अब क्या टाइम हुआ? 9:07। 4-5 बात के बाद मस्करी साहब ने पूछे, यार तुम बोले पूछे जा रहे हो टाइम क्या तकलीफ है तुम्हें? नहीं सर, पहला सर्जरी है मेरा, कभी आंख का सर्जरी हुआ नहीं है। तो मस्करी साहब ने बताया, इट सीम्स दिस मस्ट बी एग्जैजरेशन बाय सीनियर मस्कटी। घबराओ नहीं, मेरा भी पहला सर्जरी है ये। So I'm particularly fond that young people should be benefited by a skill enhancement program. We cannot improve medical colleges. I know it's not our purview, but this can be done. So I will appeal to the current and future leaders of AIOS to consider this big data collection somehow or other. And that too is just like Irish does it. Two, can you have a partly participate in national health policy making or state health policy making, eye health policy making? And third is this. Now, having said that, because now I'm partly in public health also, 2030 is the hallmark for the next eye care program called fulfilling the sustainable development goal. And few weeks ago, WHO has after a lot of work with the UN and WHO is now eye has re-entered WHO. It was out. It was called NCD. Now it is separated. They have got two KPIs by 2030. Can you have a 30% increase in the effective cataract surgery and 40% increase in effective spectacle wear? It's just not counting any more cataract surgical rate, but effective cataract surgical rate, with the outcome of a vision of 612 or better on the first post-op day without any optical aid. Supposing AIOS also adapt this mission, and in addition to diabetes, glaucoma, all the things that you are already doing, then most of it will be together with the world and with the WHO. Thank you. I stop here.
Thank you, sir. I would just like to react to this because we initiated several of those things, although we are not yet there. I do agree with you completely on the part of registries. It should be there. That is something which we really lack. As far as advocacy is concerned, along with Dr. Mahipal Sachdev sir, also we visited the Secretary Health several times and told her that whatever decisions you take, as far as ophthalmology is concerned, you should have the representative from the All India Ophthalmological Society. And this was when, as soon as he took over, there was this thing about the ultrasound, that everybody has to get their ultrasounds registered. And that was linked with the general ultrasound, and ophthalmic ultrasound is absolutely different. So that is something that we did say, but because also the bureaucracy keeps changing at the level of the ministry, so I think we have to re-emphasize that further. As far as the skill enhancement center is concerned, I know that from Dr. Santhan Gopal's time, and then Dr. Ajit Babu, and then Dr. Mahipal Sachdev, we were nearly there. The blueprint was ready for the wet lab to be placed on the top floor of our AIOS headquarters, and we had a similar plan in all the zones also, so that we have one representative wet lab of AIOS in each of the zones, so that people can come and do learn their surgery in the wet labs. And 3 of the companies were willing to sponsor it and willing to take care of the whole thing. But because of the COVID, we could not do, but I'm sure we'll take it up as soon as this situation gets better. We had even been promised funding. It was nearly there, but the funding was withdrawn as soon as the COVID came up. So
we can again look at it, because it was worked out, the design, the map and the funding. So I don't think there should be any problem in Zeiss agreeing to re-sponsor it, and others also. Yes, but as she's saying, it was almost implemented. We were just, it was approved. We were just about to implement it, but COVID struck us. So that's the issue. But yes, I think that is a gnawing need for everybody to have a resource center for training within AIOS.
Regarding the fellowship program, I'll just finish it off. Regarding the fellowship program, Dr. Ashok Grover sir and myself, we went and talked to Dr. Paul, because he was at that time in charge of curricula, etc., and recognition of the regarding that, we had gone there, but Dr. Paul categorically said that fellowship doesn't come under their purview, and so they will not be accrediting any fellowship centers. And of course, I completely agree with you that we need to standardize the whole program. And
we need to do it.
Dr. Grover sir, during his time when he was in the FICO, has made a robust document, and I think again we need to revisit that and do it. So that's a huge amount of work which is still there, which is still left to be done.
Madam.
Yes.
Well, I'll just take half a minute, just in answer to Dr. T.P. Das' question, the request. In Karnataka, almost 5 years before, Government of Karnataka has formulated something called a vision committee inclusive of all our ophthalmic fraternity, like inclusive of the president of Karnataka Ophthalmic Society, secretary, president of Bangalore Ophthalmic Society, and inclusive of all medical college HOD. There are 30 members committee. In the end, with the help of Dr. Professor Chandrasekhar Shetty and also Bhujang Shetty, also part of the committee, we could able to get a Karnataka eye health policy almost 3 years before, and it has been done. A GO government order already has been done. They are going to implement from this year onwards.
I didn't want to say this, but I am the chairperson for the Orissa Government of Orissa's Universal Eye Health Program. And the rank of a cabinet minister, I know how much it works, how much doesn't work. And despite all our effort, believe me, that whether it's a society of a state or India basis, somehow we are kind of ignored by the policymakers, what Amrita told, because there's very quick turnover of the bureaucrats. Some bureaucrats like you, some doesn't like you, doesn't happen. A system is to be created, just not the persons will come and go. Someday you and I also will go away, but systems are not there. Like example, American Academy of Ophthalmology is a part of the entire ophthalmic fraternity of all the universities. So like that, I'm talking that can we have a system incorporated with the vibrant people like Namrata working so hard and Maipal before Barun coming, etc., etc. I'm sure you should keep on trying till you succeed instead of giving up. I know how difficult it is because last 4 years I'm working in the government of Orissa. I know what it is and how it works also, but it has to be persisted.
I think Namrata will agree that we have written a letter to the government of India to make the office bearers, mainly the president, secretary, and treasurer, to be part of the ophthalmic committee to decide the policies.
What is the use when you cannot at all force any government officer or the minister anywhere in any state? What is the use of doing that? We have done this and we have done that. Has it been implemented in any state or country? I was NPSB chairman and my advisor has to be AIOS director, AIOS chief of the Army Center. You will come once in a week and order me around. If this is the system of NPCB,
I think chief of the center is by default the advisor to the government of India. That is.
No, but what I'm saying is, does it do anything for helping the NSPB? I have written many times that why can't we have the fellowships in North India like AIOS of all the subjects? And why can't we fight for accreditation of the fellowships in this country? What Dr. Grover has achieved all these years? Or any of us?
Professor Malik, may I say something?
No, listen to me first.
What achieved is
I have been elder to you. I have been 1 year looking after the National Program of Control of Blindness.
Yes.
I did my best, but IAS would never budge neither to minister and not to doctors. So you have Nehru failed, Indira Gandhi failed, and they admitted it that this ICS or IAS, they just ruin us.
But there is a lot that we can do at our level, which I will elaborate when I speak.
Shall we?
Shall we? Can we have Dr. R.V. Azad, sir?
Oh, sir. I think sir is not there.
R.V. Azad. Ashok, sir.
I think most of the things have been covered very well, but I'll begin by saying that AIOS is possibly the best specialty society amongst all in the country. And we are one of the best ophthalmic specialties in the world. There's no denying that. And it is the work of all those who have come before us, as was said. You do better every time because you are standing on the shoulders of all those who have gone before you. So that is why the society is doing very well. And we have no doubt that we will do very well. But there are certain things which have been already spoken about. I would like to re-emphasize them. The education part remains one of the difficulties. As I always say that we have developed a very nice super structure, but we still lack a good foundation, which can only come when we have a uniform postgraduate teaching. I think the postgraduate teaching programs have helped a lot. AIOS programs have helped a lot, including the regional programs which we started during my presidentship. but there is a lot that remains to be done, and that will only come about when we have a uniform exit exam. And that is where we will need to work on National Medical Commission, that we need to ensure that the state governments fund the medical colleges well, and that will only happen if there is statutory requirement that they have to have that kind of equipment. And that will only happen if they have to give a uniform exit exam, and they will see that their candidates can only pass if they provide that infrastructure at their medical colleges. So this is one area we need to work at. And of course, we have spoken about fellowship programs. If until the NMC thinks about it, it is time for us to at least do that. You know, when this particular policy was being formed for education for the NMC, there was no mention of fellowships in that. So I wrote that at least mention it so that it is there in the future expansion programs of what NMC does. So we should, at our level, once we have finalized the curricula, at least start enforcing that. This is a consensus document of all major institutions in the country. They can get together and enforce it and start standardizing the fellowship programs, standardizing fellowship curricula, and the exit exams. All of that can be very well done. The only other aspect which I keep saying to Namrata, to Mahipal, is advocacy, because unless we do that, we are not going to achieve anything. We've already spoken about how we should be influencing the health policies, the legislations. Say, for example, in ocular trauma, how to prevent trauma, there need to be a lot of legislations with regard to that. Things like that will not happen unless we do an advocacy.
So in the international society,
and as Mahipal stressed,
yeah, I think advocacy was at its best last year and last at least 18 months.
Yeah,
we were at
we
our
have
best
already done a lot, but we keep to institutionalize it.
Yeah.
From the moment people join the societies, they should be made part of advocacy groups.
Yeah.
We should do advocacy at the municipal corporation level, at panchayat level, at legislature level, at judiciary level, at parliament level. We should have people who are trained to do that, who are trained to communicate what is best for public and what is best for physicians or ophthalmologists. That will have to be done. And we will not achieve any of these things unless we strengthen our AIOS headquarters and secretariat very well, as Mahipal very well articulated. We need a very good office and a lot of managerial power there.
So actually, like if you remember in American Academy of Ophthalmology and all the other international societies, they have one person who's only responsible for advocacy, only responsible for networking with the various government offices.
Namrata, not one person. Namrata,
no,
there are 20 ophthalmologists.
One head of the institution.
600 ophthalmologists meet during the American Academy for 2 days, and they do advocacy with Washington. And I'm part of that. And then they have 600 ophthalmologists called surgery by surgeons fighting against optometrists there. And they don't attend any of the academic session.
No, so they have
advocacy.
They have a face which represents the society as far as advocacy is concerned. And I think that really we need to do. And they have a very strong lobby over there, which is very close to like our parliament. Like we need to get close to our politicians.
Namrata, so I always told, when I told this, every time I remember Dr. Azad has not joined here. Azad used to tell, why do you want to copy America? I said, we should copy America not for Coke and Pepsi, but we should copy American Academy for all this. There are 5 vice presidents. Each vice president is an ABA, and they have a CEO. And then they have an executive ophthalmologist. What is the name right now?
CEO, the CEO of the.
So when we checked in 2011, they had 198 full-time employees.
No, they have 265.
Yeah. So
even during the COVID, they have 265. Now I'm part of the the museum committee, and the museum committee has got $12 million from 2 ophthalmologists donated. We have Keki Mehta. I think he can donate a lot. He's still working more than me.
So Dr. Natarajan, we've still made museum without any donation.
Yeah. No, but we can get money. What I'm trying to tell people like Keki Mehta can definitely give, because he's such a rich man and he's got a rich son and he's adopted me also. So I have some share. After all that, he can still give.
So AIOS is rich. We must accept.
Yeah, we are all rich. Even I am rich. I'm not shy to say that. Thanks to Keki, who made me rich.
Thank you, Nati. Thank you.
NSD Raju sir is there, and NSD Raju
No,
sir.
Dr. Shukla is ready to talk, I think. Dr. Shukla?
Yes, sure.
Dr. Shukla, sir. Sir, you're muted. Dr.
Unmute
Shukla.
yourself, sir.
Sir, you're muted. Sir, you're muted.
Admin, can you unmute Dr. B. Shukla?
Yeah, somebody is there with him. I should unmute him. Sir, somebody is speaking. Dr. Shukla.
Yes.
Yes, we can hear you, sir.
Namaste, sir.
I'm also hearing, but something had gone wrong, so I could not participate. I'm sorry for that.
Yeah, you can talk, sir. You can give your words of wisdom.
No, I'm hearing you very well. I can hear you. Keep
Thank
on
you very
talking.
much.
We want you to give your words of wisdom.
Oh. No, all very wise. I don't need to give you.
No, sir. This session is a past president. What are you envisaging for AIOS in the next 10 years or 15 years?
I was just thinking, how will you get on this? The number is increasing so much, and how will you manage these conferences? That will be a big problem because the number is increasing.
No,
So
we have convention centers in Dwaraka, in Bombay, which can accommodate 10-20,000 in the whole conference.
Yes.
Conferences will become hybrid, sir.
No, once the corona goes, 10,000 may come, as sir is suggesting. It's a Mumegi Shakkar, but I think we have convention centers now in Bombay, Cochin, and Dwaraka.
Physical infrastructure exists.
Yeah, no, these three are 100% sure. We can have
Spaces
10,000
should be
ophthalmologists attending.
You forgot Hyderabad, Nati.
Hyderabad also. Sorry.
Yes.
Yeah, Hyderabad also. I'm sorry.
No.
So,
Dr. Natarajan.
yeah, sir, Shukla sir. Yes, sir. Please speak.
Yeah, because we have been holding the conference in big hotels so far. But I remember in Bombay also about a few years back, there's a lot of problem because there's no space that and there's no big hotels.
So now we have Geo Convention Center thanks to Mukesh Ambani.
That's what I'm saying. You have to have a convention center, not the hotels. We're meant for conference only.
Yes, sir.
Only
Yes, sir.
Yeah. So
there are 4 cities like that now. Delhi, Dwarka, Bombay, Cochin, Hyderabad.
It's just in USA also they're having their only 5 places in USA.
Yes,
they're having their, so the same way we have to do.
Yes, sir.
Calcutta, that new center of Calcutta also.
Yes, sir.
New center, but it cannot. It's not able to. Correct. We can accommodate. Yes, there are halls with 5,000
coming up.
No, there are halls with 5,000 and
5,000 seating capacity.
Yeah, I know. Sorry. Yes, Bishwa Bangla.
I think both Ahmedabad and Calcutta have wonderful convention centers. If I'm right.
The point is, we have physical centers, but we have to be equipped to educate the 10,000 ophthalmologists when they come. And that's the message Dr. Shukla is giving. And maybe next, Partha, who's that?
Dr. NSD Raju sir is there, and Raju sir has promised to sing 2 lines before he starts his address to us.
Good,
Raju
good.
Sir?
Dr. Raju? इधर गया
की बात करके भगा दिया.
Okay. Anita Panda ma'am.
But what about Keki Mehta, yaar? Partha, Keki is senior.
After.
No, everybody is senior here.
Keki Mehta, sir. Sorry.
You want me to talk?
Yes, sir.
You have to give your words of wisdom. What do you want for all India in the next 10 years?
No, basically what we are doing at present is great. We have need to increase our teaching ability for especially the junior ophthalmologists. You see, what is happening just now is you have a collection of, let us say, about 150 or 200 or 250 major speakers. The rest of them are not really coming up as much as they should. What we now need to do is to build up your second and third line, something which I tried to do when I was scientific chairman and which Nati so effectively followed. But that's what we need to do. We need to build up the lower ranks at present. We have got a pyramid which is very narrow. We need to have a wider base pyramid. Not only that, people are hesitant to come from smaller centers. We need to increase their participation more. Now, the question is whether a lot of them can afford A, the travel, B, the stay, and C, their registration fees. Registration fees we can do something about. Stay, we have to now look out for hotels which are more economical and which can be partially subsidized. Till the present moment, we have never thought of the subsidy concept for hotels. There's no reason why, say, a company like Zeiss cannot subsidize a hotel, or for any of the other companies can subsidize a hotel. With the result is that you only have to pay 50% and you have more people coming and staying. More people staying, more participation, bigger conference, and therefore better teaching. That's what I was really thinking about.
Thank you very much, sir. Thank you. I mean, this has always been there. 24,000 plus members we have, sir, today. And the younger rungs are actually much better than what we used to be when we were of their age. So this time, we have tried to expand the program as much as possible, put in a very large menu, put in as many speakers as we could accommodate. But because this was a virtual platform, sir. But the other good thing that has been happening over time, sir, is the virtual platform, which gives access not only to everybody in the periphery, but also the speakers in the periphery can have a podium presence in the virtual platform. So mixing both the physical, which is very, very important, as well as the virtual. Like, for example, when we were as Chairman ARC, I could do a lot of programs in the periphery, could take the physical platform to the periphery. And it was a very vibrant platform, sir. You're absolutely right in saying so. We have a lot of talent in the smaller towns, in the smaller cities, where we need to go. And that's the way for the physical, as well as amalgamate it with the virtual. And I think we are all winners if that can happen.
Call it hybrid conference. You need more hybridicity.
Yes, sir. Thank you, sir.
But you are doing a great job, Partha. I must congratulate you.
Thank you very much, sir. Thank you. So do we have NSD Raju, sir?
Raju, yeah, sir. I am very much here. I am very much here.
Sir, so
can you hear me?
The song.
The song.
Start with the song, then I don't have to speak, no?
That's okay.
Sir, song is more important, sir.
Okay, then. I will send a Mukesh songs, I sing Mukesh songs,
We know.
From the film Anand, but just one.
He's also teaching
so.
me.
Huh?
He's also teaching me, sending me lessons by phone.
Yeah, he is my student. Guru Shishya.
Yeah.
Grover ji. Okay. Can you hear me?
Yes.
Can you hear the humming?
Humming. Yeah.
Very well. Is it?
Madam,
are you able to hear the humming?
Yes, carry on.
Very well. कहीं दूर जब दिन ढल जाए सांझ की दुल्हन बदन चुराए चुपके से आए कहीं दूर जब दिन ढल जाए सांझ की दुल्हन बदन चुराए चुपके से आए मेरे ख्यालों के आंगन में कोई सपनों के दीप जलाए कहीं दूर जब दिन ढल जाए सांझ की दुल्हन बदन चुराए चुपके से आए Thank you.
Thank you very much, sir. Thank you. Thank you, sir.
I must say some few words also.
Yes, please, sir.
Okay, thank you. In the first place, let me express my full gratitude and gratefulness to the present team of office bearers who are doing just wonderful work. And Partha, especially, you took pains to organize this conclave and invite these old people from the past to come over here and be part of this meeting in a conclave. That was great. I think I must really be on behalf of everybody. Let me take this opportunity to thank the present team for this gesture, which I think was a great one. Well, a few things which I remember when I was president and all those things. I just remember in my presidential address, I thought I just mentioned about the global projection of the Indian ophthalmology then, because I knew that there was a lot of talent and we were on par with any international ophthalmology level at any country you take. But at that time, it was a decade ago when I was the president, and I thought it was time for us to project it. Unless you project ourselves and make it known that we have the potential, we have the capacity, we have the experience, we have the expertise to be the best ophthalmologists, among the best ophthalmologists in the world. And I'm glad that our followers, the rest of they took this up on they made a great stride. And for them, the sky was the limit. And they were able to now, Indian ophthalmology has almost reached that level where it is considered as one of the best ophthalmic societies. Indian ophthalmology is being revered and respected by the rest of the world, the ophthalmic world. That's a great thing. So that is one thing. Because in order to do that, we also organized, when I was the president, to the resource centers, in American ophthalmology, Academy of Ophthalmology meeting, then in the ACRS, and also in the Sri Lanka. What was that? It was APIOS. Sri Lanka, then South Korea. So all those places we did a resource center, which also helped us to project what we have been doing. So that way, it is a great thing. I always remember that with great gratitude. So my advice is that let us continue this, and let us project it more emphatically, time and again. Another thing which I thought was the professional protection scheme of the society was not completely covering all the members, so they always face something or other legal entanglements, very trivial things. Once you have a complaint, then you are done for that. You have to be after that. The mental agony, the worry, everything comes in. So I thought there should be some sort of a system which could take care of their problem and work for them and help them to get out of that sort of a situation, which is more common in the southern part, but now I find it is more common in the northern side also. So altogether, it is a great problem, and we have formed an alliance with the IMA at that time, and many of our members have joined. And I think even now more people are joining. We must strengthen that and try to cover all the members, because that infrastructure is already there in the IMA. We can make complete use of that. That is another thing. And what is that? About the building. So that was also our dream. Maybe Lalit was there, then Harbans was there, then Dr. Anita Pandey, Dr. Malik. We all thought of making a building, because it was a dilapidated one when we took over, when I was the vice president and all. Then it gained momentum, and we were able to, streamline the whole thing and work together as a unit. We used to go to Delhi so many times, go to many places, get in the contractors, and so there are so many things, there are some paperwork, so we have to be after some offices, so all those things were done in a matter of, I think, 2 or 3 years. But unfortunately, the building came into shape and inaugurated only after me. And Dr. Anita was fortunate enough to inaugurate that building. So that is another thing which I thought. Now, what we thought, we should have a center like, something like American Academy has. So there we can project some sort of that thing is there, but we should have a full-fledged one. That is another thing. The other thing which I had when I became the president was to have a theme song for the society because of my interest in music, maybe. But then I asked my previous president, Dr. Azad, and he penned the lines and told me the meaning. I thought it was a very good one. So I tuned that, and then there were so many applications for this one, and this governing committee listened to all the songs and finally decided it is NSDs that is the best. I don't know if that was a partisan attitude. Somehow it got it through, and this became the song. But our present secretary, Dr. Namrata, has a small complaint because she said the songs are good. You have sung it very well with your professional playback singer girl. You have done it well, but she wants a little improvement in the video part of it. I said that's probably correct because and we were in fact trying
Can you please limit the speaker's time and give us time that somebody will speak 5 minutes or 6 minutes
all of a
or 8
sudden we
minutes?
have to put a
Thank you
stop
for
to that.
unmuting me, but at least give the time to everyone.
Yeah,
to speak.
okay. I'm so sorry that
Don't
I
keep
trespassed
somebody
my
unmute
time.
and don't
So
mute
that was
anyone.
another thing. So my only message to the presenter team is that all these things will have to be streamlined, and we have to move forward as a great force and make the Indian ophthalmology one of the best ophthalmic societies in the world. Thank you very much. Sorry for trespassing my time limits.
Thank you very much, sir. Thank you, Raju, sir. Shall we now come to Madam Dr. Anita Panda, Madam? Dr. Anita Panda, Madam.
We don't have this background.
Dr. Kuresh Maskati, sir. Dr.
Partha, I'll be brief because we are running out of time.
Yes, sir. 15 more minutes, we have to close the session.
Yeah, so just one point. It's an extension of what Ashok was saying, that in my year as president, we tried very hard to revive FICO, because FICO is not only for giving awards at the inaugural ceremony, some by selection and by election and by examination. But my dream for FICO was much, much bigger. And with Ashok, we tried to do this, what Ashok was saying. We got the heads of all the major institutions, the RP Center, the LV Prasad, the Shankar Netralaya, Arvind, to come together. We've made a curriculum. Even if the NMC is not with us, even if the exit exam for all at MD or MS level takes time, at least for cornea, retina, squint, we can have a common exam done by AIOS, a fellowship exam. So whether you passed from LV Prasad or you passed from Jumri Talaya, or you've done a fellowship in squint from LV Prasad or Jumri Talaya, if you pass that exam, that exit exam, then you are declared squint expert from the AIOS, whatever you call it, FICO, whatever it is. So I thought we were almost 90% there till Ashok was unceremoniously and illegally removed from the FICO chairmanship. Then this never saw the light of day. But I would really like FICO to look at this. We are there. We are almost there. Ashok can give you everything. Everything is there with you. Thank you.
Thank you very much, sir. Thank you. Can we have Dr. Devashish Bhattacharya, sir?
Thank you, Partho. And thanks, Mahipal, for a wonderful year in office through this difficult time. And
Partho, I am the last, or I am not allowed to speak?
No,
I am not allowed to speak?
No, sir. Definitely, sir. Whenever you wish.
Why
sir.
should I be the last if I am senior to so many?
No, sir.
no, please come, sir. Please come.
Sir, why don't you speak, sir, first?
So, thank you. It is just to mention that I, as a ARC chairman, I did introduce the thesis competitions and all that, and I think I did some of the things which voting online. It was Rajendran and me combined fought for it, and then problem like, I'm audible?
Yeah, very
Yes,
much.
sir. Yes, sir. Very well.
I sent some amendments right from Bombay till to the next committee, but I never get the acknowledgement that they have received my suggestions or anything. And then I would not give a speech to you. I have suggested zonal rotations of the office bearers, and so that whole country get a feel of it. Then I wanted the tenure of the AIOS should be not 3 years but 2 years, and the one was that the surgery part of the medical colleges for postgraduates in this country is very poor. Can we do something? If not for the students, can we train first the surgeons or the teachers who don't know themselves surgery, and they cannot teach their students the surgery? That is to be considered, because for students, I think on hands training, you cannot really give them the training. AIOS cannot do except simulation, and simulation doesn't teach the surgery. Then innovations should be rewarded, and that should be published. I used to believe in childhood that papers writing is nothing till you really give something in a paper. Like I gave small Sadhajang sutures, which help the old people from epiphora, sutureless pterygium, glueless pterygium, and the bimanual rexis. Some of the things which I feel that a surgery innovation should come from all of us, younger, and in your publications like IGO, they should be promoted. And if need be, the editor should edit them or rewrite for young ones if somebody writes innovation. And other, of course, was the NPCB or government role for AIOS. We have all failed because you have kept people out who could do something. So that you need to consider it. And that's all I wanted to say, that you need to not to give so many lengthy lectures, but do something for PGs and for teachers. Thank you.
Thank you very much, sir. Thank you very much. Thank you, sir. Thank you. Sir, can we have Dr. Devashish Bhattacharya, sir?
Yeah. So I really thank Maipal for a wonderful year in office, and the entire GC guiding us through this difficult period, and Partho and the entire chairman scientific committee for putting up such a great show, and the AIOS secretariat, this entire virtual conference. During my presidentship tenure, I had recommended, but it's a difficult task, to Lalit, then the chairman, scientific committee, that we have a preferred practice pattern, learning from his write-up on endophthalmitis, which is almost followed as a Bible in the operation theater. So, we divide the practice pattern in 3 levels, at primary level, secondary level, and tertiary level, with the facilities that could be in a semi-rural or a semi-urban and in a urban tertiary care center. So depending on these centers, what should be the guideline for every OPD investigative and surgical practice pattern? We come up with practice patterns, but this can be vetted through the other subspecialty societies. If we take a concerted effort, I think we can be there. This is something that members definitely look forward to. And the second thing I would want to see, again, we were discussing about the PG program. There's so much of information today, but it has to be collated properly so that a postgraduate, when he joins, he has a structured textbook. Today, it's very difficult to have a textbook. There's so much over the internet, but what should he read? I think AIOS, with all these beautiful people, can collate that. Over this COVID time, I found that I explored the AIOS in a very digital way. And definitely, we should strengthen all that we've learned. And I think our Facebook presence must be good because, as Tony sir was saying, I'm sure he does Facebook. And if we are there on Facebook, I think these things can come digitally to him. And going forward, what TP said, it is definitely, that is the utopian area we would like to be. But AIOS should at least try and carry on multi-centric studies because AIOS is capable of doing that. Collate, maybe Disha, Arvind, LBPI, Shankanetralaya, other practices, and have a multi-center big data thing. The absolute big data thing, yes, we were also carrying this forward. If we could supply softwares or provide softwares to every practice, we can ask for data instead and then collate it. It is a possibility, but it will evolve over a period of time. So,
well, thanks for endorsing.
Thank you very much, sir.
Yeah. Thanks, Andos. I am most happy to help anybody who wants to, because that is where our ophthalmology is behind actually, to put a footprint on the national, international scene. That is what is required. Actually, we are not doing it.
So these are a few of my
Namrata, Barun, or whoever.
These are a few of my thoughts, and I wish Barun and his team, though I don't see him here, with the incoming president and the entire GC, to carry us through this still struggling times. Thank you.
Thank you. Thank you, sir. Thank you very much, sir. So we would like to finish the session in time. Ramurthy sir is there. So Ramurthy sir, a few words of your advice.
Thank you so much, Partha, for putting this together, and hearty congratulations to Maipal and his team for a job well done, a wonderful, challenging year that's gone by, and all the very best to Barun Naik for carrying the flag ahead. I think people much wiser than me have spoken before on advocacy, education, training, all have been aptly covered. I would just like to develop on one single point, which I think is also of relevance, because this was also about giving some sort of advice to the people who are at the helm of affairs now. The relationship with the trade, of which I had a part to play in the past 1 year also, in the sense that it's extremely important that we have some definite guidelines for this relationship. Initiative has to come both from the society members as well as from the trade. Mind you, not all trade are bad and not all members are good. So it works both ways. So we need to have guidelines. I find that as far as purchase of equipment is concerned, having certain rates fixed and etc. may not be possible. But as we discussed even in the trade committee meeting a couple of days back, the more irritating thing is the after-sales service, maintenance of equipment, etc. It's very much possible for the AIOS as a body to enter into a sort of an agreement with different trade organizations to have a certain percentage fixed as a CMC, AMC, and ensure that that's strictly adhered to. Just a week back, I was asked to pay 12 lakhs for a resonator of a green laser because of my contacts, and I could completely nullify it, but it could have been very difficult for a younger ophthalmologist. So I think the society can play a very significant role in this aspect, and maybe the people who are coming to power can strongly consider this.
Thank you very much, sir. In fact, this year in these COVID times, Dr. Maipal sir played a very, very strong role on this point, and many of us, the whole ophthalmological fraternity benefited from this. So thanks a lot, but these words are very important for us. So shall we come to Dr. Santan Gopal sir, and then to Dr. Ajit Babu Maje sir.
Thank you very much, Partho, and the office bearers of AIOS, President Maipal, everybody. All the presidents before me have done a great job. It was easy for me to do my job. But three things I would like to mention as a part of my process. Number one, need to distribute part of the funds for the AIOS to all the societies, depending on the number of people from the different states who attend the AIOS annual meet. Now, this has two implications. The members feel a part of AIOS when the money goes back to their state. If 100 people come from one state and some part of the money from the AIOS goes back to the state society, the members of that society will feel part of the AIOS. So that is very essential, and the AIOS can dictate as to how this fund that is given by AIOS to the state societies can be utilized. We are unnecessarily accumulating money which is not doing anything. Instead of that, we can use that in the state societies for the benefit, real benefit of the members in the periphery who are more likely to attend the state's annual meeting than the AIOS. And therefore, we must think of a way of distributing the excess funds, keeping whatever that is needed for AIOS, distribute a part of the excess fund to the state societies for the promotion of the scientific activity of the different state societies. That is one point I wish to see at some stage. Number two, I wish to see that the AIOS meetings, annual meetings, are conducted only in those cities which have excellent convention center, which have good transport and accommodational facilities. See, if it means that it is only 5 cities or 6 cities, that's okay. People will still come to those 5 or 6 cities just like they go to 5 or 6 cities in US. Nothing wrong. You pay less money for accommodation, you pay less money for transportation, you spend less time in getting there. So it is worth looking at it more seriously to keep only in 6 or 7 cities and not necessarily to distribute to all the smaller cities also the conference. The last point I would like to make is the constitutional change is essential because anything that does not change rots. So the situation keeps changing, so the constitutional changes are needed. Whatever may be the opinion of some people, because of constitutional change only we have now online elections where more than 10,000 people have voted in a number of elections in the past. So please do not be very adamant that there should not be any constitutional change. There should be, depending on whether it helps the members at large or not. Thank you very much.
Thank you very much, sir. And we are just in closing time. So Dr. Ajit Babu, sir.
Thank you, Partha, for arranging such a nice conclave where every president has expressed his views. And I would like to congratulate Dr. Mahipal for a successful tenure he had, even in spite of COVID era, difficult era. My main thing is that all wings should be given more freedom and more responsibility as well. Means each wing should be an individual governing body by themselves doing very well. That is number one. Number two, we have cracked the APAO. This thing, there was an embargo on AIOS. It is during my tenure we had a meeting and we had an understanding which is very, very protective. Both AIOS has not yielded. At the same time, we have given them a chance to think over. So let us not cut off from the international scenario. We have a large membership strength that we need to play to our favor. The third point is that there is a disconnect between the seniors and juniors, which somehow we need to address and bring these juniors, not only academic, but the administrative abilities that need to be utilized. And each term, if you see the presidents, one after the other said, I have done this, I have done this. And over time, once the president changes, the policies are going into cold storage. That should not happen. I think with these 3-4 points, I will stop because rest of the presidents have expressed a lot of things which need to be implemented.
Thank you very much. We have made a note of the things you have said, the advice you have given. Extremely grateful. to all of you for having gathered here. And I wish this conclave goes on, not only for the annual conferences.
I think Natarajan need to speak. He already spoke so much, but still he need to speak.
I want to just give my vision. One is a homework given by Dr. Nagpal to have a senior ophthalmology lounge, which I think Namrata did in Indore, I think. So we have to have a Dr. Tony Fernandez reminded that I think I'll take up that writing a newsletter for the senior ophthalmologist for maybe the past president. And the other one is one day I want to see we are better than AIO. That's my vision.
Fantastic, sir.
Good evening.
I think we should fulfill. हम होंगे कामयाब एक दिन.
This president's lounge was started by Quresh Muscati in Agra. That was the first time I think Quresh Muscati gave that idea, and I'm happy that Partho has given this name as President Conclave, and I think that this should be carried. I remember Quresh Muscati telling me that a meeting karenge. So what I did was that when I was chair of Scientific Committee, so all those awards were given on the third night, where we'll have an informal get-together between all the presidents as well as the foreign faculty and the award winners. Remember, Quresh, in Agra, you started this when Ramu was the chairman of the Scientific Committee, and I was
very much. Yeah.
That was the time.
That was the Diamond Jubilee IGO conference.
Yeah.
So Partha, I think great suggestion, but my only 2 cents are maybe you can hold this session apart from the conference, because that give more time and it can be more structured, and then you can have minutes written out of it and the recommendations kind of given. So that's just maybe Namrata can also hold it, or anybody, but that's my 2 cents that it should be because there are too many things that are happening and you can't do just.
No, Maipal, actually this should not come under chairman of scientific committee. There's nothing.
That's what I'm saying. That's why I said
I think president or you or maybe Namrata can take a lead in this.
No, that is why I suggested, Lalit, I requested Namrata and Partha that we should have a software where people like you, me, Maipal and all, where we are involved. I think I think we can't do justice. We have to be in one session only and nothing else. No panelists here, judge there, chairman here. It's overwhelming that to be there. I am now also next to
one sore point is that last 30 seconds, that whatever ideas all these wise people with gray hairs or no hairs have told, how to make use of those points. You see, that is more important. What Tony Fernandez, what Devashish, what Ramu, what KPS and everybody told, if we don't implement any of those, then it's a failure of this meeting. So therefore,
see,
note these points. And
then, all the members of GC, they speak outside the GC meeting. Actually, you people should speak a lot during the GC meeting and do a constructive point-wise workout.
So what I was saying, let not the advice remain an advice. Advice should convert into an action also.
Yeah.
With this, namaste. Thank you so much.
Thank you, Partha. Finally, and
Okay, before sir,
I'm sorry for my words if I hurt someone.
No, sir. Before I call up, I apologize to KPS Malik, sir. Actually, the back-end IT person would have unwittingly done this, unmuting it. I'm extremely
sorry, we are all single family, nothing like that.
No, how long you can unmute me, but you can
always
never, sir. You are unmuted, sir. You are always unmuted, sir.
Picture.
Oh, but you could have unmuted yourself.
Ramu,
no, better no. No, better no.
Right. I think
Ramu is not there.
Okay, bye now.
We'll just take a quick photograph.
Okay, Muscati, thank you very much.
Thank you, KPS.
Are we going to have a group photograph?
Yes, we are.
So Partha, do the honors.
Yes.
Sir, I have no time, nothing.
Taken. Photograph taken.
Okay.
Good night.
Thank you.
Good night.
Wonderful meeting and conclave.
Thank you very much.
Once again, congratulations.
We have taken a group.
Let us have more occasion to
taken a group photograph, but we are missing the post-meeting dinner.